So, good morning, ma'am. This is Shela Mae, Primor, AMDNA. So, for today, we are going to demonstrate the wound care. So, let's proceed to the procedure. Procedure number 1 is we have to review medical order for dressing and change procedure. So, we have to review this. And after that, we have to explain procedure to the client and instruct client not to touch the wound care or sterile supplies. So good morning, ma'am. I am your nursing assistant, Shela Mae Primor. Kisa ganito mo ngalan, ma'am?
Jelly Luias.
Pila mo edad gani, ma'am?
11.
Okay. So, ma'am, maglimpyo ko sa imong sa madron. Okay ra ba? So, ang akong kuan ni mga dili ka magitapika kanimo sa mad kay basig ma-infection na niya. Okay ra, ma'am? So, step number 3, we have to close room or cubicle curtains and windows. So, we have to close this to provide the privacy of the patient. And the door is already locked. Step number 5, position client comfortably and drape with bath blanket to expose only the wound site. So, ma'am, okay na kaning nga position? So, ako na mag-drape na ko, ma'am, ha, kay parang maglimpyo na ko sa imong samad. Okay na, ma'am? So, step number 5, we have to place waste receptacle with reach of work area. So, this is our paper receptacle. We have to place it near the one side. Step number 6 is we have to apply face mask and protective eyewear if required and wash hands thoroughly. So, we are going to perform only hand hygiene using an alcohol. Step number 7 is we have to put on clean gloves and or disposable gloves and remove tape, bandage, or ties. So, here is our clean gloves. So now we are done putting our clean gloves. Let's proceed to number 8. Remove tape. Pull parallel to skin and towards dressing. Remove remaining adhesive from skin. So we are doing it gently. Relax your mom. And dispose it to the paper receptacle. So step number 9 is with glove hand, carefully remove gauge dressing one layer at a time. So we already removed it, taking care not to dislodge drains or tubes. Keep soiled undersurface away from the client's side. So we have to keep the distance between this paper receptacle to our patients. So, in addition, if dressing sticks on a wet to dry dressing, you have to do not moisten it. Instead, gently free dressing and alert client of potential discomfort. Next is we have to observe character and amount of drain drainage on dressing and appearance of the wound. So we are observing the wounds of our clients, of how it is look like. Next is dispose of soil dressing in waste receptacle. So we already done disposing the drainage of our wound of our patients. Next is we have to remove our clean gloves by pulling them outside. And put it in the paper waste receptacle. Then, after that, we have to open sterile dressing tray or the individual wrap sterile supplies and place it on the bedside of table. So we have here the sterile gloves. We have to maintain the sterility of our equipment. So we have to be careful in opening this equipment. Now let's proceed to dry dressing. So number 1 is you have to open bottle of solution if ordered and pour it into sterile basin. So we have here a sterile basin and this solution. Second is we have to apply the sterile gloves. So here is our sterile gloves. Next is we have to inspect wound for appearance, drainage, and integrity. So we have to avoid contact with the contaminated material. So as we know that these are the contaminated materials including this. So we have to avoid that. And then we have to cleanse wound with solution. So here is our sterile equipment. And you have to use the separate swab for each cleanse stroke for cleansing. One stroke and then we have to dispose it to our receptacle. And after that, you have to clean from least contaminated area to most contaminated area. So that's what we are doing lately. And then number 5, you have to use dry gauge to swab in same manner in step number 6 to dry the wound. So we have here, we have another here. This is for cleansing and the final. You have to perform the most contaminated area to at least the not contaminated area. And dispose it. And number 7, we have to apply the sterile dressing to incision or the wound. In addition, you have to apply the antiseptic ointment if ordered using same technique as for cleansing. So letter A, we have to apply loose woman gauze as contact. So here is a gauze. And then you have to cut 4x4 gauze. So since it is already 4x4, as you can see, it is already 4x4. You have to flat to fit around grain if present. So pre-cut is also available. So since it is already cut, so we have to flat it to the wound. Then last is we have to apply thicker woven pad. So here is and that's it. Now let's move on to wet dry dressing. Number 1 is we have to pour prescribed solution into sterile basin and add fine mesh gauze. So this one. Second is you have to apply the sterile gloves. So here. And then third is you have to inspect wound color for characteristic or drainage or type of suture. So you have to inspect this. And then number 4 is you have to clean wound with prescribed antiseptic solution or normal saline. So here. And then next is we have to apply moist fine mesh gauze as a single layer directly into towards the surface. You can have or you can use picking forceps if you want. So once we're done, we have to apply dry sterile 4x4 gauze. And lastly, we have to remove our gloves. And lastly, we have to assist client to comfortable position and dispose the supplies and wash hands. So, ma'am, okay na ka niya position? Di na kinahanglan nga kuan, uswag-uswag ka?
Okay naman.
Oh, okay na siya. So, okay naman itong patient. So, we have to wash our hands. And after washing hands, we have to kuha na dito mga equipments and mabalik na tayo. That's all and thank you.